Of all my roles and accomplishments at Johns Hopkins, there is none that I am prouder of than being the parent of two current Hopkins students, a medical student and an MD PhD student. With this in mind, may I ask all of the assembled to join me, and especially the graduates, in giving a round of applause to the parents, spouses, and other family members and friends that helped bring the graduates to this special moment in their lives. This is not your first graduation. You've graduated all your lives, from grade school, high school, college. However, this one is like no other. You are not just moving to the next phase of your education. Once you have an MD or a PhD, you are, from this moment on, a different person. You're a doctor with all the privileges and awesome responsibilities that your new identity brings. On my first day in medical school in 1974, at our orientation, we were told that we were embarking on an intense educational journey where we would work hard, but we would be rewarded by acquiring a tremendous amount of information about medicine. A very inspiring thought. However, we were warned that half of what we so painstakingly acquired would later be scientifically proven wrong or irrelevant. The catch-22 was that we still needed to learn it all because no one could predict which half would turn out to be true and critically important. The rest of our careers would be spent seeking to better understand what was true and relevant and to acquire new knowledge. In fact, in every field of medicine, the way we now practice is radically different and absolutely safer and better for our patients than the best care provided when I graduated from medical school. And I am sure that 30 years from now, the practice of medical will make many of our current practices seem primitive. And as medicine changes, so will your practice. While medicine has changed, we as people have not. And our patients have certainly not. We have the same needs, fears, desires, and hopes that unify us as part of the human race. These principles defy time. The guiding principles that have so fundamentally influenced me in my own career will remain constant and will be as true in the future as they are today, and were in the past when I learned them from my mentors. My mentor in medical school, Judah Folkman, was the surgeon-in-chief at Boston's Children's Hospital and was renowned for creating the field of angiogenesis. He saw this lifelong challenge as the twin challenges of personal versus general ignorance. Personal ignorance is information you should know. This means that there is data out there that you could use to help your patients, but you don't have it, but should, to do justice to your patient. The information that you may not know, but everybody else does. This problem is remedied by lifelong study. General ignorance, however, is much more daunting. The entire profession doesn't understand the disease. No one knows the correct answers. We watch helplessly as bad outcomes occur to the patients who trust their care to us, but no one knows how to treat them better. Yet we, as physicians and as scientists, are obligated to try. Let me share with you my own journey in this respect. As a medical student, I contributed to two major discoveries. First, together with Judah Folkman, we described the first known inhibitor of angiogenesis. That is, we were able to show that we could stop blood vessels from growing into tumors or into the eye during certain diseases. Today, anti-angiogenesis has become routine treatment for cancers and for eye diseases. Second, working with a postdoctoral fellow, Bob Langer, who today is the commencement speaker at the Hopkins Carey Business School graduation this evening, we showed that there was a way to use polymers to deliver minute amounts of drug directly to their targets in the brain without causing undesired effects to the rest of the body. I chose these questions to explore because I realized that they were not only scientifically challenging and exciting, but that the answers could be very high impact on fundamentally changing how patients could be treated. Each discovery opened the door to other questions and then to other discoveries. These discoveries were able to be translated to improving our understanding of the workings of the body and improving outcomes. The next stage of my career, my residency, was devoted to learning how to take care of patients in my chosen specialty of neurosurgery. The expertise, knowledge, and technical skills necessary to care for the patients entrusted to me at times seemed overwhelming. It required a tremendous amount of study, practice, and ultimately mastery of the practices and knowledge available. I was committed to ensuring that every patient I was privileged to take care of would get the very best possible care, and they would not suffer as a result of my personal ignorance. And so I studied and worked very hard. In recent years, residency work hours have improved and changed dramatically. The need to master clinical medicine has not. Residency work rules have advantages and disadvantages. Be aware that the expertise is harder to achieve in fewer hours. Therefore, focus on self-motivated learning to get that experience. Take advantage of the reduced hours to analyze opportunities to explore newer and better approaches to taking care of patients and therefore advance the field of medicine. After I completed my neurosurgical training at Columbia, I felt privileged to be able to practice neurosurgery, but was struck by how devastating the outcomes were in so many of the patients that we treated. I decided to devote my academic career to improving the outcomes for patients with brain tumors. Amazingly, I was strongly advised by many academic leaders not to do so. They said this was a bad career choice. Their logic was that so many brilliant scientists and clinicians had devoted their careers to brain tumor therapy, and it was really to no appreciable benefit. No significant change in the outlook for patients with malignant brain tumors had occurred in the previous 50 years, and the outlook remained dismal, with most patients only surviving for a few months. Their advice was that I use my painfully acquired skills, surgical skills, and not try to change the inevitable course of this disease. I was proud that I could take care of people with neurosurgical problems, but I realized quickly that I could not be satisfied facing patients with unacceptable outcomes and not doing my best to change the general ignorance that is the state of the field.